So hello, today was chemo 10, so let's talk about it. This was my outfit. I wore the hat that Ashley got me. It's chemo 10 of 12 paclitaxel. You might hear me say Taxol for short. Then I have 4 of what's AC. The street word for that is called the Red Devil. I feel like I should say it like a Southern preacher. Namely because it has a red tint to it, but it is a little bit harsher on the body for some people. Chemo 10 went okay. I didn't have my cream for my port, so we froze it as much as we could, and you felt it when they put that big needle. It's a big hook needle. But once they got it in, it was okay. Side effects, they give you so much. You get Pepsid, you get Benadryl, you get steroids before they even start the actual chemo. And they do it in phases. They get you hooked up to the IV with saline, and then they give you the Pepsid. Or I don't know, different nurses do the different. But there's a whole half hour of spread out of them giving you these before the chemo even starts. And it's to help with nausea and some of the other side effects that chemo is known to have. So the chemo infusion lasts about an hour from the time it starts dripping to the time they flush it. For Taxol, because one of the big side effects that the pre-meds can't help is neuropathy of the hands and feet. So something they found that helps is freezing your hands and feet. You may have seen me in a picture with purple mitts on my hands and feet, and they have these refreezable inserts like what you'd use for your lunchbox, and you put them in pockets and you wear them mitts and the feet covers. You start at 15 minutes before the chemo starts, during chemo, and then you leave them on 15 minutes after. This is supposed to help minimize the neuropathy. And for me, being on chemo 10, I have 0 symptoms thus far of neuropathy. I want to say it helps. I don't know if it'll help everybody. And maybe I'll get it on my last 2. I don't know. The AC doesn't do it. I won't have to freeze my hands and feet. My toes get frozen. I got to take them off sometimes and warm them up and then put them back on. My toes get frozen. Actually, they're called Susie pads specifically for this reason. They're made for that. And they actually say on the package, don't wear longer than 30 minutes at a time. Take them off, then put them back on. I can only guess for too much cold exposure to the extremities. Out of all the doctors I have, oncologist, Dr. Lejeune, Dr. Elizabeth Lejeune, oncology surgeon, Dr. Tasha Martin. I have a radiologist that's going to do the radiation. She is female. I don't remember her name. I only met her once. I meet with her June for a better plan of that. The radiologist who actually performed the biopsy, female. She was in Crowley. I have my plastic surgeon, Dr. Lupo, male. He's wonderful. What I did not have was a regular doctor. I didn't have just a regular doctor. And every time I go, they ask me, who's your regular doctor? I don't have one. So we finally got me set up with one through Oxnard. Her name is Dr. Nguyen out of Youngsville. I met her today. Not a lot she can do for me while I'm in this process because my oncologist is calling the shots. As I've learned, even supplements can affect the chemo. So there's certain things you can take and there's certain things you can't take. And it's the pathway in the system. And if it goes in the same pathway that the chemo does, you cannot take it because it can affect the chemo. And we ain't going through all this to have the chemo be affected. So basically with supplements, I can take anything that's like one ingredient. I can take vitamin B, B12. I can take vitamin D. I can take magnesium. And you need vitamin D with magnesium anyways, but I take them separate. But I can't take magnesium glycerate or whatever. I can't take something that's multiple. It's got to be like a one and done. For instance, I can take melatonin, but it can't be melatonin and so that's been interesting, but I finally found a set of things that I can take. I take some in the morning, some in the evening that help. I do take fish oil every night. I take a melatonin. I do magnesium, and then that's when I take the vitamin D, which after menopause, you should be on vitamin D anyways. I've been on it for 10 years. Vitamin B12 I take in the morning. I do take an allergy med daily. That helps with the bone pain. And then I do have Benadryl at home and Tylenol or Motrin. So that's kind of the routine there. So far, it's not been too bad. I'm a good patient though. I'm a good student. I do what the doctors say. I follow the instructions. There's a reason they put me out of work. That was because your white blood cell and your red blood cell get real low. And specifically the white, you can't be in large crowds because you don't have anything to fight off even the common cold. So I've protected myself from that. I quit making Costco trips. I quit going to Walmart unless I have to, pharmacy out. If I need groceries, I hit Champagne's in Erath. Or I send Ariel. Or I order it shipped home. I've put on, between the steroids and the paclitaxel, chemo causing water retention, steroids just causing weight gain, since the beginning of all this to now, I put on 20 pounds. Since the beginning of chemo till now, I put on 14 pounds. So remember, there were 2 months after surgery where I couldn't do anything. There wasn't a whole lot I can do. So I had put on some weight then. I put on about 5-6 pounds then. 6 pounds. Then 14 for the chemo. They did lower my dose of steroid, because I did make a comment to the doctor, Dr. Lejeune. I told her, I said, oh, I've gained 3 more pounds that week. And she said, yeah, well, don't be mad. The chemo causes weight gain. The steroids that help you feel good causes weight gain. So it's common to put on weight, but she did lower my dose of the steroid. It went from 10 to 8. That's helped. I only gained... Actually, I didn't gain any weight this last week. The week before, I think I only gained 1 pound. I've cut out, if you know me, you know I enjoy my beverages. I did cut out all of that. I did have a few beers a couple weeks ago at a crawfish boil, and I had a couple glasses of wine that weekend, but since then I haven't done any. I find I feel better. My body can fight this better. The chemo affects everything. The blood work comes back. It affects your liver. It affects your kidneys. It affects the inflammation in your body, which is why I believe whatever you're already fighting that might be inflammatory, it exaggerates. So if you had arthritis, it exaggerates it. I have bunions. It's exaggerated it 100-fold. I have kind of finger injuries from when I worked at Fruit of the Loom. It's not arthritis yet, but I get swollen joints in 2 fingers where I sewed. They get inflamed more than ever. I have IBS. It's inflamed more than ever. So I feel like, for me at least, the things you already deal with, it affects even more. So that's been an interesting learning, really trying to stay with foods that are anti-inflammatory, drinks that are anti-inflammatory, to really kind of help not blow up like a balloon and be in pain. I'm trying to get on a routine of sleep. Not working. I'm not going to lie. At the beginning, I was hither-tither. I was staying up late, sleeping all morning. I wasn't on any kind of routine, so I've decided to put me on more of a routine. I want to get ready to get back to work in September. But yeah, that's where we're at. 2 more Taxol. Then I opted, she gave me the opportunity to give myself a break for a few weeks before I start the AC. I feel like as of right now, I'm not doing great, but I'm doing well enough that I think that, although I do believe that AC will be rougher on me, I want to start it the week after my last Taxol. I don't want to give a break. I want to hit it, get it done. That one will be once a week, every 2 weeks. And what they call dense dose. So it's a higher dose, which might be why your symptoms are worse, your side effects. It's a higher dose with a longer time in between the infusions. So my paclitaxel is a smaller dose once a week. That'll be higher dose once every other week. So they say you hit your symptoms hard that first week after, then the next week is recovery and you start feeling better, and then you get the next one. And that one's only 4, so it's 8 weeks, 4 infusions. Then I'll get a break for a few weeks, and in June we'll talk about radiation. Radiation is going to be either 20 or 25. It's every day, 5 days a week, for either 4 weeks or 5 weeks. They haven't decided yet. So that's where we're at. I'm going to do a get ready with me video tomorrow. I have a new skincare regimen. Trying to take care of that skin. Chemo really does a number on your skin. You get dryness up here, so I get bloody noses late at night. I keep a humidifier by the bed. You also can get, some people say acne. It's really not. You just get really red skin and little blotchy stuff. And it goes away. It'll clear up. At least for me. You lose hair everywhere. Everywhere. I haven't lost brows completely or lashes completely yet. But the mustache is hanging on for dear life. If you know, you know. That mustache is hanging on. It's kind of funny. Anyways, I hope you're doing well. I hope you're all doing well. Sorry I haven't been on in a while. I'll get better at it. I've been just focusing on doing what the doctors are saying, resting when I need, exercising when I need, doing the things I need to do to help keep myself a mind wellness and mental wellness and keep my brain healthy through all this. So have a good night, and I'll talk to you later. Bye.